Hi, my name is Allie, and this is going to be washing the upper or lower dentures skill video. Hi, Miss Jones. My name is Allie, and I'm going to be your CNA today. I would provide them some privacy, and then I would go and make sure that the bed is completely lowered and that the brakes are locked. Miss Jones, is right now a good time to clean your dentures? Yes, okay, thank you. Then I would leave the room to gather my supplies. My supplies would be 1 pair of gloves and 2 washcloths. I would come back into the room and I would go into their bathroom area where they have their dentures, their toothpaste, and their toothbrush. The first thing I would do is take one of the towels and lay it in the sink. The second thing I would do is take my barrier towel and lay it here. Then I would put on my gloves. Okay, I would next turn on both faucets. I would take their dentures and take the lid off. I would rinse the lid first and set that on my barrier towel. Next thing I would do is I would take the dentures out. I would dump this water, rinse it, and then fill it up and set that over. I'll put it back over here, and I will set the dentures down on the barrier towel. The next thing I would do is I would get their toothbrush and I would rinse that. I would then get toothpaste and apply the toothpaste. I would then get their dentures that I have made a mold out of with tin foil. And I would start washing all surfaces of the dentures, including the gums, the front and back of the teeth, the chewing surfaces, okay. All right, now that I've cleaned all of that, I would first rinse the toothbrush and set that aside. I would then take the dentures and rinse those to make sure that there is absolutely no toothpaste. I would then put these back into the cup and close it with the lid. The next thing that I would do is I would turn the faucet off and I would start my cleanup. I would take this towel and my other barrier towel and roll them up without contaminating myself. I would take these and put them into the designated dirty linens. Okay, the next thing that I would do is I would take off my gloves without contaminating myself and throw those away. The next thing I would do is I would go back over to my patient and I would make sure that their bed is completely lowered and that the brakes are locked. I would make sure that their call light is in hand and in reach of them. And I would pull back the privacy curtain and wash my hands and then skill complete.